Hi, I'm Vabren Watts with Psychiatric News. This year marks the 46th anniversary of National Hispanic Month, an observance celebrating the contributions of Spanish and Latin Americans. Today, to help us celebrate National Hispanic Heritage Month, we have with us Dr. Jane Delgado, President and CEO of the National Alliance for Hispanic Health. Are there differences in which psychiatrists need to be aware based on patients' national origin?
I think it's not so much national origin, but what we know about people. So, for example, when prescribing medications, there's very little data by race, ethnicity, or gender. For example, we know for Hispanics, one of the reasons that we may live longer even though we're overweight and have diabetes is how we metabolize our fats. So fat-soluble medications with us have to be delivered in a different way, but we don't have enough data on it because that's not how the clinical trials were done.
So are there any cultural elements that mental health professionals need to be aware of when treating this population?
Well, I think the most important thing to do is to always do what you want, but listen to the patient. So you have to meet them where they're at, and very often it's hard for people to do that because they can't leave their own cultural or experience background.
So the rate of seeking mental health care among the Hispanic and Latino population is low. What can psychiatrists do and other mental health professionals do in order to reduce this stigma that is associated with receiving mental health care among this population?
Well, you know, Mrs. Rosalind Carter has been working on stigma for decades. For as long as I've known her and as a young woman working with her on stigma, we're still working on stigma because the bottom line is that people still think that mental health issues are things you should be able to get over on yourself or that it's a sign of weakness. I think that we have to sort of recast all this, not just for Hispanics, but for everyone else.
Well, thank you so much for joining us today, Dr.
You're
Delgado.
welcome.
I'm Vabren Watts, and this is Psychiatric News.